Good morning, everybody. I'm very glad to welcome you for the opening of this staff week about AI in health. I would like to begin to warmly thanks and congratulate the PROMES team for the organization of this staff week. To this opening, I would like to talk to you about the AI in medicine of the future. That means much opportunities, but also challenges. Let's go. After remembering about AI, we talk about these opportunities and major challenges, and we could evoke what solution we could find to answer to these problems, and finally some words of conclusions. First, what is AI? We heard of AI since 1950 with Alan Turing, the English mathematician who broke the Enigma code. And Alan Turing describes AI that is the ability of a machine to imitate human cognitive function. And he developed the Turing test. The Turing test evaluates whether a machine can imitate human intelligence. And if the human judge cannot distinguish the machine from the human through the text-based conversation, the machine is considered to have passed the test and is artificial intelligence. But besides this first definition, artificial intelligence in reality is just the treatment of data, because intelligence is meaning data and no brainful work. Artificial intelligence is an historical science because the first step of AI dates back to 1940 when two mathematicians invented the concept of artificial neurons. Then in 1950, Alan Turing discussed artificial intelligence, and in 1966, during the Dartmouth conference, the term of AI was published for the first time. From 1950 to 1960, mathematicians kept developing mathematical theories that still form the foundation of AI today. But then between 60s and 80s, the topic fell into decline. It was only in 86 when the now famous Geoffrey Hinton, Nobel Prize winner in physics for his work on AI, that modern artificial intelligence began in its new era with the emergence of backpropagation and deep neural networks. But if we talk about Geoffrey Hinton, and we are French, so we have to mention Yann Lequin, another pioneer of modern AI, who notably discovered the convolutional neural networks for image analysis. So AI could work with data. Data is the fuel of AI because AI algorithms learn from data to recognize patterns and make a prediction. So if the volume of data is very important, the quality is a major issue to make AI better. So in AI, we have to say garbage in, garbage out. Data quality is the most important way. Sorry, I have a technical problem. Okay. So what are opportunities of AI in healthcare? artificial intelligence has the potential to transform healthcare. It's a reality. This technological breakthrough affect medical diagnosis and decision support as much as it improves the efficiency of healthcare professional research and training. Indeed, the first application of AI in medicine has to transcript of interview between patients and doctor, for example, to summary of medical records, and to assistance with radiological diagnostics. Is some example which are present in our hospitals to help diagnosis or to improve our efficiency. AI could also help us to summary and drafting our medical reports, to generate synthetic data that allow to improve the quality of medical images, for example, and could perform the automatic anomaly detection in radiology image, for example, but also in biologic results. Besides help in diagnosis and therapeutic decision, AI improve also medical research. That is a very important way. I only cite a few examples. First is the literature review summary. Every day 10,000 of scientific publication appear. So it's a very hard work to keep the up-to-date in scientific publication, and AI could help us to identify which publication is very interesting and could summary this publication. The second point is the help in clinical study, and AI could help in the design of clinical study, but also assistance with patient inclusion and the patient follow-up and data analysis with a new way of data analysis that allow us to access in a new information, and next in assistance with scientific valorization, that is to say, to draft publication. And finally, the third point I would like to talk to is the synthetic cohort. Now we could produce synthetic data, synthetic patients, and include these patients, these synthetic patients, in a cohort to improve the powerful of clinical study. Sorry. The last point it's the educational help of AI in medicine. Two examples: the production of adaptive content, adaptive to students, adaptive to the specialty of medicine, and the generation of health simulation scenarios on the simulation tools powered by AI that allow students to expose of real simulated situations. But besides this high potential of AI with many opportunities, there are also challenges for healthcare. 8 challenges, major challenges, are described next. Ethical issue, data-related issue, the risk of alienation is a major risk. The teaching and training issue is also very important, and some challenges that is common with all application of AI, that are environmental issues, sovereignty, economical and societal issues. So first, ethical issue. So I don't want to develop this point because we see you on Wednesday for a talk about this subject. But the first point I could say today is how it could cause discrimination. The first discrimination is AI non-access for population instead of numerical breakdown. In France, about 5 million persons are considered to are in a state of numerical breakdown, so it's a very major subject. The second challenge is data-related issue. In AI for healthcare, data are not like any other data. They are health data. So health data are very specific because they are sensitive data, confidential, heterogeneous and complex data, variable in meaning, in format, and they are massive data with temporal bias. And finally, problems related to data security and confidentiality is very important in health data, and the responsible use need to respect of privacy. Because the misuse of data can lead to bias and discrimination, and the expertise in handling this data is essential. I would remind that for reference, health data are available because they are collected during the patient care. It's the relationship of trust between the patient and their doctor that allows the patient to entrust all of their medical data to their physician. Alienation is also a very big challenges in AI for health, but also in AI for all other sectors. The massive and unreasonable use of AI could lead to generate dependence and a loss of critical thinking, and the loss of expertise could result in an inability to provide the essential human guarantees required for the use of AI in healthcare. And you could see on this slide Jack Villeray, that is an actor who played in a film, in a French movie called Le Dîner de Cons, Dinner of Idiots, that seem the way we could work if we are not careful about the critical thinking. This is a formation, the art of the critical thinking and the expertise, and we have to modify, to adapt training with the AI, because the use of AI by students is widespread now, and it remains essential to ensure the acquisition of fundamental knowledge, the development of critical thinking. So I still talk. The mental structuring through the experimentation and the structuration of data and the acquisition of complex reasoning skills. Let us recall that AI is not a stable technology. It needs to be retrained with new data and revalidated in order to maintain its level of performance. The risk of dumbing down the population is higher if we don't address these problematics. Next, it's an environmental issue. AI is very energy intensive, both its development, that is to say training on a massive data set, and also for its use. It produces a large amount of carbon emission. For example, to produce this presentation, I used the AI to generate images. This results in a carbon cost of around 36 kilograms of CO2, which is equivalent to driving about 350 kilometers by a car, thermic car. And the water consumption of this presentation is about 1.5 liters of water. The sovereignty is an important issue, an important challenge, because currently the vast majority of algorithms for healthcare are not developed in France or in Europe, but is mainly in developing in China or United States. That generate three problems. First, the bias related to training data that non-representative population of population French or European population. Second problems, the lack of control over the economic trajectory, because if we are dependent to non-European companies, we are dependent of their economic way. On the in view of geopolitical problems, the deliberate interference in health public policies. Economical issue is the main limitation to the diffusion of AI in health. We often hear of the AI transform health. AI is now the main tools for health professional, but is wrong. It's wrong because in France, healthcare AI algorithm costs 30 to 100,000 euros per year. So we need one algorithm, my disease, injury, exam, or answer, and in hospitals, we treat several tens of thousands of different diseases. So to diffuse, spread AI in all fields of hospital work, we have to spend very, very expensive cost. AI could therefore end up costing several tens of ever hundreds of millions by hospital. That is unsustainable. This cost must be added of the cost of IT infrastructure and the lack of control over economic trajectory. So the risk of economic unsustainability of AI is major, and it's a big limitation to the spread and the potential of AI in health. Finally, we have to talk about the societal issues. To illustrate this societal issue, I would like to show you an example, an exaggerated example, that is Jeffrey Hinton, the pre-Nobel in physics. Jeffrey Hinton said in 1996, radiologists are like the coyote already over the edge of the cliff, who hasn't yet looked down. And he added, we should stop training radiologists now. In 5 years, deep learning is going to do better. But we are more than 5 years later, 1996, and we already need radiologists. But radiologists use AI to improve their diagnostic capacities. But it's a very hard talk about Jeffrey Hinton that ask many questions. And finally, AI is generating societal question. The sudden and unprepared arrival of AI in hospitals can lead to fears of replacement that is very present in the hospital teams. The fear of job loss, loss of meaning in one's profession linked to the dehumanization of tasks, because if that is AI in first line, it's not the human relation. This may result in 3 points: a lack of acceptance of AI tools, a technological rejection, and a widening of the digital divide. But face to these challenges, there is a few solutions. First, an AI developed by domain experts, healthcare professional, is a first way to trustworthy AI systems. Also with explainable algorithm on the transparency algorithm. The guarantee of vulnerability through an independent real-world testing. That is the work of hospital first with real-world data and experimentation in real conditions. The adaptation of training, I said that before, to AI with a continuous assessment to preserve critical thinking and expertise. It's the main way to preserve us of alienation with AI. And last, the integration of AI into a continuous evaluation process, because we have to verify that AI performance are continuous high, and we have to have a human main decision on medical decision. So in this slide, I show you the example of a complete ecosystem for AI in healthcare that is the response to the many challenges I talk about you. The first way, it's an institute, the Artificial Intelligence Institute for Health. It's a team of more than 56 persons, included engineers and researchers, and the Promise team is included in this team. It's 58 million euro of fundraising and a budget of 11 million euro. Institute of Artificial Intelligence for Health is a 10 national or European project with four goals: awareness, training, research and development, and valorization. In conclusions, AI is not only a computer science, it has a tremendous potential for improvement. It's the main role of domain experts. This role is major and essential for identifications of problems and that are their problems, selectioning of training data and validation data, and with the algorithm validation and experimentation in real-world conditions. Training is the central key points of AI success for students, with the building of critical thinking, AI training, and the adaptation of training courses, and for professional with high training and with continuous evaluations. So we have to develop an ecosystem to access to data, to health data, and to develop algorithms, and the involvement of healthcare professionals in algorithm development to ensure economic sustainability and sovereignty is the main point to allow us to benefit of AI. The importance of energy sovereignty, because AI is a very energetic consumer, and the economic modeling to guarantee public health sustainability is a key point. So it's the last slide, and I thank you for your attention.